Dr. Molly Rutherford is a physician, one of the doctors who is a part of this Flatten the Fear project. Flattenthefear.com is a site that many listeners have gone to. This is all brought to you by the Job Creators Network Foundation. It is a real honor to welcome on our guest line and on Skype, Dr. Molly Rutherford. Doctor, great having you on the program. How are you today?
Good morning. I'm doing well. Thanks for having me.
Let's talk about the spike that we keep hearing of coronavirus. All of us who are watching this nervously have an anxious eye on the way things are going. How do you, as a doctor, approach the data as it's being reported? Because I'm sure your patients are asking you about what normal life is going to look like.
Right. There are many things to consider as these increased numbers of cases are being reported. In Kentucky, what I do is I look at the actual data every day and I try to post that on my website, on my practice website, and on the Facebook page. And what you have to do is you have to remember that we are testing more people. Many people, like just going back to work, if they complain of a symptom or if their temperature is mildly elevated, they're going to get a test. These are people that would not have gotten a test a few months ago. A few months ago, we were testing people who were quite sick. So we're detecting many more asymptomatic cases. So what people really need to do is divide the number of positive tests by the number of tests done, and then follow that percentage to see what's really going on.
Sure. You hear the phrase, is the cure worse than the disease? A lot of doctors we've spoken to, they agree with the initial lockdown, maybe a 30-day lockdown initially, but then it got worse and worse. We isolated everyone, and we really didn't do enough to protect those who are truly vulnerable. Is there merit to that argument, doctor?
In From what I'm seeing, yes, absolutely. I think I don't fault anyone from the beginning. I don't fault the recommendations from the beginning because we were acting on the information that we had, and it turns out, the models were exaggerated, and that's, I'm not going to play Monday morning quarterback on that. However, just common sense and logic, anyone who thinks logically should be able to tell that people not having jobs, people not going to work, people with addiction, they're going to have cravings due to anxiety. People relapse. In Louisville, Kentucky, we're seeing an increase in the number of shootings, the number of homicides, and the number of overdoses this year. And while I can't prove that that's because of the lockdowns, it just logically makes sense. And then people just not going to the doctor out of fear, not going to the ER because they don't want to catch COVID, and just neglecting their other medical problems. It's a serious issue.
You mentioned Kentucky, and of course, Dr. Molly Rutherford is our guest. She owns BlueGrass Family Wellness, a direct primary care and addiction treatment practice in Crestwood, Kentucky, and is part of the Flatten the Fear campaign from our friends at Job Creators Network Foundation. I notice as you specialize in addiction treatment, I can't even begin to imagine the mental health and the addiction perils of people who have been locked down all this time. It's got to be a really dreadful scenario for lots of Americans, doctor.
It is. It's a dreadful scenario for people who are in recovery, just having cravings, experiencing relapse, not being able to go to their usual recovery meetings. And it's also bad for kids that are at home with parents who struggle with active addiction. The kids, I'm seeing so many mental health problems among young kids due to this isolation. It's really it's it's really frightening, and I just hope that people will use common sense, that our leaders, our politicians will use common sense and reopen the schools this fall.
Well, we're going to find out, and I appreciate your participation in this campaign. Flattenthefear.com is the site that I hope our listeners go to. And Dr. Molly Rutherford, I appreciate you taking time out of your schedule to join us here on Team
Thank,
Gallagher. We appreciate it.
Thanks for having me on.
My pleasure. Again, go to flattenthefear.com. This is, again, we need to protect our most vulnerable, but a large part of our population can and should start to get back to living lives without fear. FlattenTheFear.com.